much summer light, that's for sure. Turning now back to the coronavirus for you, it has been over 3 months since emergency departments, ERs everywhere, started seeing a surge in COVID-19 patients. Channel 3's Dennis House talked with a nursing manager at Hartford Hospital about how patient care is now changing.
Ever since the pandemic began, we've been hearing stories about people who've been putting off essential health care. They might have a critical problem in their lives, but they're not going to the hospital because they're afraid of coronavirus. Joining me now is Audrey Scott. She's the assistant nurse manager in the emergency department at Hartford Hospital. Audrey, good to see you.
Thank you for having me on.
I want to begin with when you get complaints like this that people haven't been going because they're afraid of coronavirus, what do you say to them?
I mean, it's an understandable fear for people, but I just want to tell people that we are following all the safety precautions. Safety is one of our core values at Hartford Healthcare, and I think we've done a really great job in the emergency department of ensuring safety for all of our patients, those who have COVID and those who have not. So we are definitely seeing some patients that waited out of fear, and their conditions likely worsened while they waited at home rather than seeking treatment immediately.
What kind of things could worsen during the pandemic if they weren't taken care of them?
Strokes, heart conditions, things like that are definitely emergent conditions. We've been seeing situations where some of those patients did wait at home and came in where we could have maybe intervened earlier to treat them.
So is there a big influx now that people feel a little bit more comfortable?
We are definitely seeing an increasing volume. The number of our COVID patients is going down, and we're seeing an increasing volume of our typical ER patient that we would see on a normal basis now that people's lives are getting back to normal. Our trauma volume is going up a little bit, just, you know, as people are going outside with accidents and things like that. So our numbers are definitely going up, but we're prepared.
What about people putting off their yearly physical exams or vaccines and things like that?
I think it's really important that people follow up with their primary care providers and ensure that they're getting the preventative treatment and maintenance treatments and things like that to ensure that you don't have to come to the emergency department. I think that's essential, and people should feel safe under the care of their providers.
Audrey Scott, we appreciate you joining us, and I want to thank you very much. I got the opportunity to meet you during the Denise DiCenzo Foundation check presentation, and it was that was really an amazing day.
It was.
Thank you for being there. Audrey Scott from
Yeah,
Hartford
thank you
Hospital.
so much.
Have a good day.
Thank you, Dennis.